when you've heard your practitioner say, this is the new one for you, you're holding the bottle of Celexa in your hand and you're wondering, is it going to work? And if it does, what are the negatives that might come with it? Am I going to regret this? You're not alone. Celexa, also known as citalopram, is one of the original SSRIs, or selective serotonin reuptake inhibitors, used to treat depression and anxiety. But here's the truth. I almost never prescribe it anymore. I'm Dr. David Danish, a double board certified psychiatrist specializing in depression and anxiety in children, adolescents, and adults. I prescribed Celexa to hundreds of patients in the past, although almost none recently. So let me walk you through what really matters: when it works, what's tricky about it, and the other side effects to watch for. Celexa is an SSRI, which means it boosts serotonin, a brain chemical that helps regulate mood and emotion by preventing it from being reabsorbed by the cells too quickly. Celexa is FDA approved to treat major depressive disorder in adults. Clinically, I sometimes use it off-label for anxiety as well, including generalized anxiety disorder, panic disorder, OCD, premenstrual dysphoric disorder, symptoms of PTSD, social anxiety. Does it work? Yes. Celexa outperforms placebo in large trials for all of these disorders, even though it's not FDA approved for all of them. But compared to other SSRIs like Lexapro, Zoloft, Prozac, Celexa usually doesn't stand out. Here's when you can expect results with any of those in 2 to 4 weeks. You might feel lighter, a bit less emotionally weighed down, or notice your anxiety doesn't grip as tightly. By 6 to 8 weeks, that's when most people see the full benefits, especially for anxiety. But as with any antidepressant, do not expect fireworks. A little more energy, a little less dread, that's a good sign it's working. Now, when I start Celexa, these are the side effects I often tell patients to watch for the most. These tend to show up early, but usually fade with time, usually within the first 5 to 7 days. And that's some nausea after you take it, some drowsiness, some fatigue, some might feel dry mouth. Again, these tend to go away over time. The ones that may not go away are sexual side effects that can occur with any antidepressant. They don't tend to occur more with Celexa than, say, Lexapro, but up to 30% of patients do have some lower libido or trouble reaching orgasm. Up to 30% of patients may also have some emotional numbing, and that tends to be dose dependent on any antidepressant. The more serious side effects, which is why we don't use Celexa as much, is the potential for heart arrhythmias. There's something called QT prolongation that can occur much more commonly with Celexa than with other SSRIs. So why start it at all if it's not more efficacious than those SSRIs, but has a higher chance of causing this cardiac problem? Now, with any antidepressant, for those who are under the age of 25, there is a 1 in 132 risk of increased suicidal thinking. This is something that needs to be expressed to every patient in that age group and something to be watched for. Here's my honest take on Celexa. I almost never start people on Celexa anymore. Why? Because its cousin Lexapro is usually cleaner, better tolerated, and actually more effective. Celexa is a 50-50 mix of 2 molecular mirror images. Only one of them, the S enantiomer, is really doing the work. And guess what? That's what Lexapro is. The other half, it may just add side effects without any extra benefit. And that may get at that longer QT prolongation of the heart, and that tends to occur at higher doses. So I find myself asking, why not just go with the cleaner Lexapro option? That said, Celexa still has a place. If a patient's already stable and loves Celexa, I'm not going to force them to change. If their parent, their sibling tried both Celexa and Lexapro or Prozac and Zoloft and they said Celexa was the only one that worked, I'm not going to fight it. But for almost any other patient, I'd reach for Lexapro, Zoloft, Prozac instead. If you found this at all helpful, please share it with someone. Please subscribe. Please hit the like button. Those little things help this video get out to more people. And if you want the full list of all potential side effects on Celexa, please head over to my MindVolt at drdaviddanish.com for a free resource that breaks it down in a very easy to understand way. Just as important as that resource is another resource called How to Supercharge Your Antidepressant. This is full of science-backed tips that apply when you're starting a new antidepressant and increase the chance that that antidepressant works for you. Again, these are science-backed and they will increase the chance tremendously that a new medication will help your depression. So to me, this is one of the most important resources I want you to look at if you are starting a new antidepressant soon. I'll see you in the next video.